easily down the road. Unfortunately, hip resurfacing was only approved in the U.S. in 2006. Few hospitals offer it, and insurance would not cover it, but Ken suspected that hip resurfacing might be right for him.
It preserves more bone, so it's not as drastic of an operation, and it provides an easier revision if something else happens down the line.
Then Ken found his Top Gun surgeon, a surgeon who worked with the British inventors of hip resurfacing 12 years ago. He has done over 600 procedures, but there was just one drawback. Dr. Malhan was 8,000 miles away in India. This former engineer and rocket scientist had made up his mind. 3 months after contacting Top Gun surgeon, Ken said goodbye to Scruffy and PJ and set out on an adventure. Ken drove to Rochester, flew to New York City, then across the ocean to Paris, and finally on to Bombay, now known as Mumbai.
I feel stiff after 23 hours of hard traveling.
In 2006, nearly 3,000 Americans and Europeans came to India in search of low prices, faster service, and procedures not readily available in the West. Take a look at a comparison shopping list. In the U.S., these are the approximate prices for heart bypass, back fusion, and hip replacement. In India, these same surgeries cost anywhere from 50 to 80% less. This does not include plane fare.
The quote that I got for the procedure, the package price is $7,500. Travel, figure another $1,500 to get over to India and back.
Ken was getting the surgery he wanted at half the price, performed by a highly experienced surgeon, first world healthcare at third world prices. Hospital staff get down to business. Day one includes x-rays, blood tests, and heart monitoring.
Now I'm just waiting to get it over with.
Ken is tired of waiting, tired of worrying. No matter how much he trusts Dr. Harrell, always risks. After all, this is his first surgery, and he's 8,000 miles from home, a world apart from loved ones. Ken Priggen of Hammondsport, New York, loves to build things, and so does his surgeon in India. Dr. resurfacing the ball joint on Ken's hip. Many feel this alternative to total hip replacement is better for younger patients and provides greater mobility. India, a nation of 1 billion plus people, is exploding with modernization. The momentum is palpable. They seem to have it all here. An advanced ICU, well-equipped physical therapy, the latest in MRI and CAT scan imaging, and an emergency room that tracks all their ambulances in real time with GPS technology. For Dennis Richards from Ormond Beach, Florida, the toughest part was convincing family and friends that he'd made the right decision. Damon Richards accompanied his dad to India. They toured the Taj Mahal together before settling into their luxurious suite. Dad got 2 new knees, while son got 23 shiny new teeth and a jaw realignment to prevent grinding.
Not only was the doctor very good at what she did, I had sent her credentials and some of her things to some of the people I know that are dentists back home, and they were impressed by them. So not only was she, fully qualified, she had great bedside manner, but at the same time, it was done quickly.
For 2 new knees, 2 extra weeks of physical therapy, 23 crowns, and 2 round-trip airfares, one-way first class, total bill was $23,000. Compare that to more than $100,000 back home. 2 days after surgery, Ken is learning to walk again. Another patient down the hall from Ken in the Amethyst Suite is Linda Evans from Wenatchee, Washington. She says her hip surgery was rejected by her insurance as a pre-existing condition. She felt like she didn't have a choice.
If it comes down to you, your life, and the wheelchair, what are you going to choose?
Don Russell just arrived from Orange County, California. At 83, he can't bear to be away from his work, remodeling houses. So he's here, hoping for a resurfaced hip like Ken.
I have contacted a surgeon that would do the resurfacing, but my health provider would not go for it. They said, no, you do our way or no way. I said, hey, I'm off to India.
Oh, you're making me so happy. Okay, you're making me so happy.
8 to 10 days after surgery, Ken will begin the arduous trip back home. Ken has Dr. Brecht's cell phone number and email address. If it becomes serious, Ken will eat some crow and visit his local doctors.
I haven't been disappointed, I haven't been elated, oh my God, sort of like, waking up was always nice. Yeah.
Well, I'm going to tell the world. I'm going to let the world know that we have options.
With healing well underway and plenty of physical therapy, Ken is back home along the Finger Lakes of New York State, finishing their house and taking long dog walks.
So that was just to give you a flavor of, how it works. And this was a few years ago, so we have actually advanced from there. Let me just tell you what we are going to discuss today. I always find to, go by the definition once in a while. Sometimes just looking and defining things gives you ideas how you need to proceed forward. So medical tourism, what's the definition? What are the growth drivers in line with the topic of, that was given to me for discussion today? What are the growth drivers for this? What are the impediments to growth? What are the key factors for a successful medical tourism destination? And finally, I hope to wind up this within next 30 minutes, and so we should be left with another 15 minutes of Q&A. I would welcome any questions. Medical tourism has been, actually it should not be called medical tourism. That's what CII attempted to coin a term called medical value tourism. It did not really take off. Some people call it's truly actually about globalization of healthcare. But if you actually see the Google trends, medical tourism is one of probably the top 10 or 15 hotly searched terms on Google. There's no getting away from this, though there is really no tourism involved in it. Any patient who takes the risk of flying to another country, it has a lot of fears and anxieties. Tourism is the last thing on his mind. He just wants to go get a safe outcome and get back home. But that's how the world has started to call this phenomena. So we'll go by that. And the media, every day the kind of stories that this has become a commonplace now. So medical tourism is where people who live in one country travel to another country to receive medical surgical care, at the same time receiving equal to or greater care than they would have in their own country. This is, I think, very important. Nobody would travel to another country to get, it's not really about, people think it's about cost arbitrage, that people go to another country because they get a cheaper treatment. Not really. Health is something, it's so personal and it's so important that nobody will compromise just for the sake of money. So receiving equal to greater care they would have in their own country, and traveling for medical care because of affordability, obviously that's the key, and better access to care or higher level of quality of care. Now some countries have actually tried to hype up this concept, like Thailand, one hospital saying we get 500,000 patients every year, and then when actually it was checked out, found that every outpatient consultation also they're calling as a patient visit or something. So, some of the exclusions, from the India perspective, if we have to really develop this into a major business, I think certain things like spa and wellness travel, which is another, I think a great opportunity for India, for the travel trade basically. Accidental medical tourists, some American is traveling and he has an accident here and some insurance company pays for his treatment in a hospital here, is really not, that's not medical tourism. Or expatriates who are foreigners getting some medical care here. So these are exclusions. So Deloitte called it a $60 billion opportunity, and this was about 3-4 years ago, and annual growth rates of 30 to 35%. So I must say that today we don't really have a handle on what is the volume and what is the total size of business, because there are various definitions and parameters by which people measure this. But with my experience in this industry of about last 12 years, I have seen this growing at a very phenomenal pace of almost 30-35% on, I mean, with the healthcare providers who are actually focused on this business. Now, talking about the growth drivers. So what is really making this phenomena, grow and become so important in last few years? In one of the recent articles I wrote for one of the journals, I started with a quote from a newspaper. 25 years ago, two of our past presidents in this country, Gyani Zail Singh and Neelam Sanjeeva Reddy, actually went to Houston for a heart surgery. Today you've seen this video, Americans are coming here for surgery. So it's a matter of great pride for us. It's not only about business. The fact that India as a country has risen up in this wave to have created an ecosystem where we can actually cater to and deliver high quality healthcare at a very affordable cost to people who take the trouble of traveling across continents to come here, I think is a great opportunity for us. So it's not only about business. I think as a nation, it should be a priority for us. So with over 200, first thing, what is really driving is, everybody's heard about baby boomers, the spurt in US population after the World War II, and not only there, but also in Europe. So these countries are now having a majority of people, and probably this will intensify in next 10 years, who will enter the senior citizen age group. So they will probably need much more healthcare. They will consume more healthcare. But they do not have young population who can, so there is an imbalance there. And one of the Boston, this is the Boston Consulting Group who had done this study a few years ago and said that while all of US and Europe will actually have a shortage of manpower, is the country like India with majority of our population below the age of 25, 30 years, and with most of them now getting educated in such tremendous institutions like Symbiosis and others, will actually have a surplus manpower and have an ability to cater to rest of the world. So this is a fact that either people from here will go and deliver healthcare, or patients from there will come and get healthcare here. Global healthcare shortage due to demographic trends, which is what I have talked about. Another fact that has come to our notice is that, particularly in the United States, which is a $3 trillion healthcare market and has been the pioneers in delivery of healthcare, there is a doctor's shortage. And in next 10 years, 34% of the doctors will retire or leave medical practice. Even otherwise, the physicians still in practice are going to see fewer patients, spend more time on administrative tasks and other actions that will limit patient access. So that's the developed world. On the other hand, the Africas and the Middle East and the developing world, the healthcare resources in the underdeveloped and developing nations and the rising demand due to global demographic trends combined, these indicate global demand for healthcare will outstrip supply. So, and India with its massive world-class pharmaceutical industries, generics, our hardware, our software, our younger people, we only need to train them and skill them. We are at the verge of tapping this great opportunity. Next is, as a growth driver, is technological change. Now, in addition to technological advancements in medical care, which provide differentiation in treatment, I mean, for example, technology has changed medicine a lot and continues to do that at a very fast pace. Medical procedures are becoming less invasive and decreasing the discomfort of recovery. Patients are more likely to consider traveling for care and more likely to engage in leisure activities also during their stay. Technology has allowed for early detection of diseases with 256 slice or whatever 500 slice PET scans and CTs and robotic surgery, HIFU. I mean, these are the things, every new hospital which is coming up in India, tertiary care, is actually investing heavily in technology, which is what is making the diagnosis much easier, quicker. And also then the delivery of the procedure, so that's a great opportunity, because when people actually travel a long distance to another country to get these done, this technology actually helps to deliver outcomes which are lesser risky, more surer, quicker, and with less risks of infection and other complications. Technology on the other side, the internet, is making the world almost live, and people are searching for what are the options available. Social media is driving a lot of change. We all know that. We are a part of it. And therefore, it's much easier for people to get in touch with the providers, the facilities, network with other people who have been through this, done that, and also take those decisions much faster. So it's easier to conduct research, to seek out care from available providers.